Health Check tonight. We continue to try to answer some of your many questions about the coronavirus. Family medical practitioner Dr. Jennifer Caudle joins us now from Rowan University to help us provide some answers and some information. Dr. Caudle, thanks for joining us tonight.
Thank you.
First off, we continue to hear about people who don't have the standard symptoms of fever, dry cough, some even losing their taste or sense of smell, or maybe even have skin rashes. Also, the CDC has even added nasal congestion and a runny nose to the list. So have your criteria changed in order to recommend someone getting a test?
Well, that's a really great question. And Rick, you bring up a really good point, which is that many people have symptoms other than fever, shortness of breath, and cough, which is what we were initially hearing about. Symptoms that you mentioned, a loss of taste and smell. Some people are also getting muscle aches, fatigue, headaches, even diarrhea, nasal congestion, as you said. So this is what I recommend folks doing. First of all, keep in mind that many places are only testing symptomatic people at this time due to, testing capabilities. However, what you should do is you need to call your doctor and go over your symptoms with them. The reason for this is that, according to the CDC, really doctors should use their clinical judgment to decide who needs a test and who does not. So if you have any symptoms that concern you, you need to call your doctor.
All right, one more quick question before we let you go. We've been hearing reports that people are spraying their masks with all sorts of disinfectants like Lysol and potentially breathing in those chemicals. Can you give us a refresher on how best to handle and not handle our masks, since we all have to wear them now?
Absolutely. Well, the masks we should be wearing are not the medical grade masks, right? Not the masks or the N95s, the surgical masks or N95s. We should be using cloth masks. And the CDC recommends that they should be washed in a washing machine. You can also hand wash them if you want, but they really need to be washed regularly. And some experts actually say to wash them after every use. You certainly want to do that, aim for that, and make sure that you're washing it at least if the mask gets soiled. Those are some things that you can do to really keep it clean. And that's what's recommended at this point.
All right, Dr. Jen from Rowan University, thank you for checking in with us once again tonight. And we'll be right back. Stay with us.